Good afternoon. I'd like to call to order the Tuesday, February 12th, 2019 Pitt County Department of Social Services Board to order. And to begin with, I'd like to observe a moment of silence. Okay, thank you. I've been told we have nobody signed up for public comment. You've received a copy of the today's agenda in your packet, and a motion to adopt if there's no revisions needed.
So moved.
Second.
Second, thank you. Okay, approved. And again, you have a copy of the previous minutes in your packet, and if people could make sure they reviewed those, and if there's no adjustments or revisions, if I could have a motion.
Move to accept.
Second.
Thank you. And I guess that I should have announced that Ms. Bryan is running late today, so I'm going to be chairing the meeting, and she may be coming. We're not sure at this point. So anyway. Okay, moving forward with the agenda, we have a number of items for consent. I'm going to let Ms. Elliott speak about those.
Okay, you have 4 budget amendments in your packet, none of which have any county dollars attached to them. Town of Ayden Energy, GUC Neighbor to Neighbor, and contributions and donations are what you're seeing. Also, we will be taking to the commissioners the application for AmeriCorps funding at their next meeting. So that is what you see in the budget amendments and items for consent. I'll be glad to answer any questions if anybody's got any.
Okay. So do I have a motion to approve?
So moved. Second.
All those in favor?
Aye.
Okay, thank you. Okay, moving along here, for under items for discussion, we're gonna move into the review of the strategic plan. And again, you received copies of those in your packets, and I think Jan's going to give us an update in terms of progress made on that plan.
Right. And I believe y'all have probably copies at your spot at the table also that are hard copies for you in case you didn't bring one. And I do need to point out that you remember the hurricane kind of got us sidetracked, and so we were late doing our initial reports. And so we're a little behind. This report goes through December 31, but it is pretty much right on top of the last report you got. And our goal ultimately is to now be able to take what we've got in our strategic plan and move it forward with some measurable progress as opposed to just reporting activities, because that's what we're doing right now is the various activities that we're reporting. So we're hoping that in the next report you can, or within the next year, you can start seeing measurable, like we've increased by 2% or 10% or whatever. So under the first goal of improved safety and support for children, we continue to meet or exceed all of our federal standards under the self-assessment and child support. And I will, as a sidebar, point out that 2 of our staff were in the top 20 in collections for North Carolina for this past month. Christina Carter had 2 collections of over $11,000 each, and Shanithia White had $9,761 collected on 1 case. So we're real proud of the fact that we had 3 collections out of 20 in the state that were the top.
Is that going beyond the call of going higher, overachieving, or whatever?
Well, it's showing that we're working our cases and making sure that we lay claim to dollars that are available to be recouped. You can see that we've increased our efforts with family visitation, the roundtables for permanency, our child and family team meetings, all of which are focusing on permanency, which is really important in our foster care programs. We should begin to see some payoff in the near future as we are achieving permanency for more and more children over a 12-month period of time. Also, stability for our children is really critical in this process, and so while they're in care, we're seeing a lot of things that are going on with our foster parents that are noted here, and actually the investment of our foster parents, because they have actually gone out and, in my mind, gone above and beyond by setting up their own pantry, closet kind of situation where they can support each other when children come into care. And they're even beginning to talk about working with our child welfare families if there's a need in some manner that they can assist to help a family have a resource that they might need. So that's some really good stuff that's happening there. Childcare, we still have no progress in increasing our numbers there. That is going to be a long-term issue and maybe, a difficult problem for us. Our goal 2, safety and support for adults. And we're clearly in a transition period with our adult services programs. We've got increased numbers receiving our in-home services programs. And CAP is the one that is a community alternative program for disabled adults. We are now filling more and more of those slots in order to keep our families in their homes, which is really important whenever possible, and keep folks safe. We certainly raise community awareness with our floral float, and you can see that our numbers are continuing to go up in the APS area, but that's what happens when you educate people about what is considered protective services for adults. You're going to see more folks calling in concerns. So that's a good thing. It's a double-edged sword, but it is a good thing for the families that we're serving.
I think it would be good right here to mention, because I find that a lot of adults who are living alone and they die, and it's a number of days before someone is aware of it, just to know that the residents need to know that all they have to do is call the Pitt County Sheriff Department, and they will put them on a list of calling. So that's important, because we had 2 to die like that right in our community.
Yeah, and it's tough when you live alone and there's
hurts.
nobody checking on you, certainly. If you look at improving opportunities for family self-sufficiency, goal 3, the partnership we have with the Navigator at Pitt Community College, working with our food stamp recipients, has been outstanding. We have certainly had an impact on the numbers enrolled in skill-up types of activities. More and more of our folks are taking programs, most of them shorter-term programs, but it gives them a skill and allows them to then move to the next level. So things like phlebotomy, CNA, welding, just a lot of programs like that. We're finding we're able to get folks to participate, and we're partnering to help pay for some of those resources folks need. We've got videos running now full-time on lots of our screens in the agency, so that in the waiting areas, on employment and how to seek employment, so that maybe offset with other activities on the video monitors, but that's constantly running with other things. The staff are doing job fairs in conjunction with other agencies, and that has been really good. Some of our folks have gotten jobs. They've also gotten the opportunity to present resumes and to talk with employers, which some of our folks don't get that option very often. So we're doing more and more of that. Goal 4, increasing communication and coordination. This year, for example, we spent a lot of time promoting the Affordable Care Act, both on our websites, in posters, in flyers, that kind of thing, for those folks who do not have health insurance. We are doing staffings on a weekly basis. We've got the technology grant from USDA to help with access and improving access for food stamps. We've done training in child welfare. We did the annual report, and I believe one of the suggestions last year was I make sure our department heads get a copy. The department heads got a copy this year. And one of the things, our emergency management folks send us updates on a regular basis about what the weather's going to be like. I mean, if we've got a first alert day, for example, and I am now forwarding those out to our services staff, because our services staff travel all over the state, and it's helpful to know kind of what you might be running into so that you can make the right kinds of safety decisions. And that was something we hadn't been doing. For Goal 5, which is staff development, we have promoted additional supervisors from within. The Leadership Academy starts this month, and it will be running for 12 months, so we're excited about that. I think all of y'all got a copy of the book and have a sense about what we'll be talking about. We have one person who's a certified global career development facilitator, so we're thrilled with that. And We continue to talk about our NC Fast training, but nobody knows when NC Fast is actually going to come to Pitt County for child welfare. I will tell you right now, the schedule is still for September for us to roll it out, but we don't know because it's moving. It's moving at a different pace right now. For Goal 6, improving our agency organization, we did some restructuring of our foster care licensing division. We added a 4th supervisor there thanks to the budget authorization from last year, and that is beginning to pay off. Also under improve agency organization, the MOU is in there, and we can talk about that later, but we do now have a signed updated maintenance of understanding agreement for memorandum of understanding. My brain isn't working today. For the next 6 months, because we had to make some adjustments since we're not being held accountable until July now instead of January. The records retention policy that we worked on for 2 years or more has finally been approved. And we are now going to be able to start doing some records destruction that we've been holding off on because of that. So those are the highlights. Certainly, I'll answer any questions. I didn't want to read it line by line.
Thank you.
Because y'all can read it. But I certainly will be happy to answer any questions people have about what's going on.
I like the fact that the payment is being tracked. Is that system that we purchased some time back, is a part of that, or what you call that thing with the bear?
Northwoods.
Northwood.
When you said bear, I knew exactly who you were talking about.
Is it? I'd like to hear a little bit about that since you mentioned the system.
Okay, well, NC Fast and Northwood's obviously 2 different things.
Right,
And there is a bridge that is supposed to be being
Right,
built
right.
between Northwoods and NC Fast. It is being done with the help of Laserfish, which is a company that is heavily embedded in the Northwoods project. And so we continue to use Northwoods. The options are that we could quit using Northwoods, or we could what they're calling the federated model, which is it will cross from our system into the state system. So, and that's the model we've chosen because, child welfare is in there, adult services is in Northwoods, child support is in Northwoods. Child support and adult services will continue to use Northwoods because they're not in NC Fast. So to just stop for child welfare didn't seem reasonable, and it provides other supports that NC Fast isn't going to provide.
Has there been a problem with the laptop or that?
The notebook?
Yes, that they carry.
The iPad.
Have there been a problem with that?
There've been moments that there've been problems with different folks. I think
because it runs on the internet.
It runs right. Well, we have our cell phones, which are set up to be the Wi-Fi, the MiFi that allows you to connect. And so all of our folks have smartphones in order to do that. So it should not be a problem, but that's not to say there are not pockets in the county that it can become a problem. But you can put the information on your iPad and then take it back to the office and sync it up. So you don't, that's not a major issue. The downside is you can't link up in real time and have the conversation or look at things in real time.
I've been curious about that for some time, and I thought this was a good place.
Does Northwoods, do they continue to offer support?
Oh, yes. Northwoods continues to offer support. We pay a maintenance agreement every year. In fact, we're getting ready to upgrade. Every year they do upgrades, and so multiple times during the year we will update the software that they are still providing to us. They have some new features that certainly we would like to look at some point in the future. But right now, we're just going to hold steady until we kind of see what's going on with NC Fast and where that goes.
That's the part that bothers me. They come out with Raleigh comes out with all these new rules and new things and new whatever, and then they can't muster up the turf to deal with it, and that bothers me, and yet they want to hold you accountable.
Any other questions for Ms. Elliott in terms of our strategic plan? And so we will get updates, is it quarterly, is that what we decided?
We said every 6 months,
Every 6
and
months.
what we're gonna try and do, because again, this would have been 15 pages, and that's what I gave you, I think, at the retreat, that we didn't get to talk about, if we listed all the little I's and E's and C's and whatever. So we're just gonna give you the goals and objectives, and we're gonna color code so that the new pieces that you get next time will have a different color from what you're currently seeing, so that you can tell what is new at a glance. And like I say, my goal ultimately is to be able to say, okay, all these things we're doing to improve safety and permanency. So what are we seeing in the way of permanency? Are we having more children have permanency? And so we've got baseline data now, so we can begin to say, okay, maybe these things are hopefully having an impact, as opposed to just reporting we're doing this or this function.
So probably in subsequent reports, we're going to be seeing that data trend in terms of which direction.
Probably on a yearly basis, not a 6-month basis, because you won't really be able to see enough.
Okay, good
Okay.
stuff. Thanks, John. Okay, moving along here, if there's no other questions, we're going to move right into the director's report and that topic that we've talked about a lot. We're going to hear more about the Medicaid transformation, implications of that.
Right. As most of you probably have seen, the state did award the Medicaid transformation contracts for the prepaid health plans. They had 8 bidders, and you had the packet. You have a slideshow in front of you that is what the state provided to us in a recent meeting. So, this is a $6 billion annual contract. So, if
As in B.
B, as in B. And it's probably one of the largest contracts the state has ever done. And if this is a 3-year contract, so that would be 3 times 6, and then it has the option of yearly extensions for up to 2 years. So I'm seeing data that says this is really a $30 billion contract.
Wow.
The award was made on February 4th, when they had 8 bidders. They awarded 4 statewide contracts, AmeriHealth, Caritas, Blue Cross and Blue Shield, United Healthcare, and WellCare were the 4 winners, and we're on page 4 of the slides. After looking at all of it, there were several regional bidders, and so they did agree, after all the scoring was over with, to select Carolina Complete Health for regions 3 and 5.
Which one are we in?
We're in 6. So Carolina Complete Health will be dealing or providing the regional health care as a regional provider-led entity. So this is a group of providers who got together and are working with a company to help do this. So they did award that bid for that particular region to say they now have at least 1 regional provider and 4 statewide providers. So Pitt County will be dealing with nothing but the statewide providers. Our go-live date was also noted on that date, and we will go live in February of 2020. Some of the counties will go live, or some of the regions will go live in November, but Pitt was not, Region 6 was not one of those. And the reasoning behind that was the go live in November tends to coincide with hurricanes.
Interesting.
And so they did not want a weather event to create problems for them. And the other issue, if you see the regions, you've got a chart here, and if you see the regions that were chosen to go live in November, they're close to Raleigh. In fact, one of Region 4 is Raleigh, which is where, of course, a lot of the folk who are making this program work reside from a state staff standpoint. And then obviously they wanted it contiguous, and so they weren't going to go east, they were going to go west. So that's why Regions 2 and 4 were chosen, or at least that was some of the discussion on the conference call. Our mailings to our clients will probably start going out in September, telling them that they need to start thinking about selecting a prepaid health plan. And so there'll be multiple mailings, multiple attempts at contacts, that kind of thing. Our job is to help direct the people to make the phone calls necessary to ask the questions. We're not to advise them on which is the best plan for them. That is the responsibility of Maximus, who are the enrollment brokers that the state is contracted with.
Is there a telephone name for Max?
There will be,
Maximus, 'cause-
they're going to have a call center, so there will be telephone numbers out there. For some counties, they're going to be potentially stationing somebody on site. They will also be doing lots of community events in the counties to try and make sure folks are aware of what's coming, talking about their various options, et cetera. So, you know, more to come on that. We're learning more every day on that piece. Now, about 1.6 million folks are going to move into this prepaid health plan in the November and February time period. So that's about 2/3 to 3/4 of the beneficiaries. So there will still be some that will be still on fee-for-service, and some of those will be those folks that are the behavioral health folks, and they'll go into the tailored plans, and that will be resolved or procured later. So there will be a small number that will continue to need the fee-for-service setup, but those are going to be smaller and smaller in numbers. And there are some groups that will never go into this. Dual enrollees, for example, people with deductibles, some of those kinds of folks will probably never go into this kind of situation. The prepaid health plans will be screening folks for the social determinants of health concerns, you know, housing, food insecurity, those kinds of things, as they work with them, so their providers will be helping do that. The healthy opportunity pilots that are supposed to be part of this, the way we're going to address the social determinants of health, they will not be up and running for another year. It's going, you know, it's going to take a while to get this part done, and then we'll move into that part. So there aren't going to be any changes in copays for our beneficiaries. They will still have the same copays they have today, which on average is a $3 copay for most services. And they will still have the same services that they currently have. There won't be any reduction or changes in services. They'll just be getting them a different way. So that's the quick update on what is going on with Medicaid transformation. Questions? I don't some days. Some days it's hard. Okay, you want me to keep moving?
Keep right.
Since nobody's asking a question.
These two are kind of like, they go together, it seems.
They
the
kind of
MOU
do,
and
yeah.
the Medicaid
Okay.
transformation.
So, as I said, the MOU, we are still testing and trying to confirm that the numbers that we are being given for the MOU are accurate as it relates to the performance measures, and there's still some concerns. Testing is ongoing. We're meeting with folks. Each county's working on that. As I said, the commissioners did authorize the manager to go ahead and sign the updated revised MOU. We will be doing that again in June because it's done for every year. So we'll be back having that conversation again. The reports, and this is more than the MOU, obviously. This is the whole part of that bill that had us do the MOU, had the social services work group, had the big study. All of that is still moving forward. Reports are being issued to the legislature, and they're listening to all of this with recommendations. So, for example, regional offices for state staff are still on the table, and they're making plans on how that's going to happen. But going back to just pure MOU, we received October and November numbers just the other day. And again, there some question about some of these numbers. And out of 26 goals, we met those goals in 12 of the performance measures. 2 of the performance measures we were not applicable for, and we exceeded the state average score in at least 2 other performance measures. Now remember, October was the hurricane month. So we were still, recovering from the hurricane by doing disaster food stamps and those things. If you look at the November report numbers, we met goals in 13 out of 25. We had 1 that was not applicable, and we exceeded the state average in 3 of the goals. And just to give you a couple of ideas about what the numbers can mean, for special assistance for the disabled, we did not meet that goal in November. We had 3 cases. 2 of them met the goal. 1 of them did not meet the goal. Well, there's, when you've got that kind of a number, you're not going to make 80 or 90%.
You can't.
You can't. There's no way. We had a situation with APS that we did not meet the goal. We had 10 cases and we met it on 9. The goal is 100%. We had 90%. So those kinds of things are going to always be an issue for us because sometimes the numbers are so small it can just 1 or 2 things can skew the numbers for you. But we're continuing to work on this. We're continuing to try and move forward. We think we're going to continue to see progress in some of these areas. But just to keep you up to date on where we are, we're not sharing scores yet because the data is still not approved by any, throughout. It's not been vetted by everybody. We're still trying to get the data vetted. And it took us a couple of years in Medicaid to get some of the data vetted. So we've got counties working on that with the state to make sure that things aren't getting missed. So once that's fully operational and that is supposed to be done by June 30, you will start then getting annual, monthly reports on how we're doing. And another issue, child support, for example, their data really is annual data. So are we moving in the right direction would be the question. Are we tracking in the right direction? Not did we meet it this month but not next month. It's are we moving in the right direction. So it's still a work in progress, but that's kind of where we are right now. Questions? Questions?
No questions, but a comment. I don't see how they can hold you accountable for anything when you can't get the data you need. I really don't.
Yeah, we're some of those reports we've never been able to see before, and we're just now beginning to be able to see those reports. So, and they're doing training for us on that. So,
Do you talk about these things at your Directors Association?
yes, we do.
Okay. So you have support.
Without a doubt.
Yes.
Good.
Okay.
Okay,
Then-
so Medicaid, the
Right.
application process?
Right. As you see, we are doing well there. We continue to meet all of those processing timelines. The 1 month that we went below back in March, we got a waiver for, so we are at 100% every month now. Our processing days go up and down a little bit, but we are meeting those goals and objectives, and so very little else to report there.
How is the morale with the staff?
I think pretty good for the most part. There's some days folks are feeling down because that's all we got a high caseloads, and there's a lot going on.
A lot of pressure.
And a lot of pressure on them.
I was just wondering.
So, we do things to support. We had a lovely event that Brian and his staff, his supervisors worked on to recognize the eligibility specialists last month. They had a soup and sandwich. They had luncheon for them.
And that's what I'm talking about, right there. That's what I'm talking about.
And they had gift cards that they were able to give out, based on drawings and things. And so there were things like that were done last month to sort of celebrate the eligibility workers and the hard work that they do.
Very good, Brian.
Okay, agency personnel. I think Susan put a new document in front of you because the one we had sent out had a typo. So we celebrated for about 15 minutes, only having 9 vacancies. It's the lowest we've probably been since I have been here for 4.5 years. So the other interesting thing is we just did a look at our turnover rate for 2018, and we were at 12%, which is fantastic. We've been pushing 18, 19% for several years.
So that's across the agency?
That's across the agency. Now, different areas have different rates, but across the agency, the average was 12%.
Which one did I want to get rid of the wrong one.
You want to get rid of the one that says,
Economic
get-
support 5.
yeah, you want to get the one that doesn't have, that has 5 and 4 on the left-hand side
There
and
you
9
go.
on the right-hand side. The other
Get
one's
rid of
not
that
good.
one.
Yeah. So,
Thank you.
so we continue to recruit. The manager has continued to work with us around trying to get positions recruited sooner. We are doing a lot of internal movement. Staff are getting promoted from eligibility to social work or into child support or various places. So the 12% turnover rate was the external turnover rate. There's a lot of movement going on in the agency. So as positions free up, people internally are being promoted
How
in.
is that program with, you knew I was going to ask
Pitt
that
Community
something.
College?
Yes, you knew that. You knew I was going to ask that.
Yeah, we've had several staff that have been trained, that after we've hired them, because it's part of the, if you don't come in here with NC Fast training, we're going to send you to Pitt Community to get that training. I think we've had 2 or 3 folks that we've done that with. What is so exciting today is that I would say every person we have hired, if they haven't come from another agency, has already completed Pitt's NC Fast training and introduction to the programs that we have here
That's
in
good.
economic
Is that your
services.
folks?
No, that's Pitt. That's Pitt Community. So that is wonderful for economic services.
I was picking
I
on
know.
her, you know.
And we're also getting more and more folks that have had their, okay, Brian, help me, career readiness assessment.
CRC.
And, yeah, the CRC, and they're coming in with good solid scores now, and we had wanted at least a silver, and we're getting some with golds. So, and we're seeing, those folks are working well. It's working well for us. So, yeah, we're still partnering. And if they've had it before they come to work, we don't have to pay for it. Ms. County Commissioner.
Very good.
Okay? So that's what's going on with agency personnel. And we have our low-income energy update, and Michelle and Brian are here to answer any questions you have. What I can say to you, and Michelle has given you an update on this crisis intervention program. What I can say to you is that on the low-income energy through February 12th, actually through January 31st, we were sitting here with 54.7% of the dollars spent, and this is a 4-month program, so we were 50% into the program. So we are on track to spend those dollars. We have already approved 2,266 households. So that's a large number of folks.
I thought that was great.
It's
when
isn't
I
that
saw
great?
it.
Yeah.
Of course, I don't know what I did with my paper by now.
I'll
but
give you
I thought
mine.
those number was really good.
I'll give you mine.
I really did. And it shows a lot of work.
It does.
too.
And we have to thank our community partners, because, so many of our community partners are taking applications for us. I mean, I know that the folks out on River Road are taking applications. We've got, Brian, 10 or 11 agencies helping us take applications on any? About 8 now, okay. So that's a help. So we're pleased there. The crisis intervention program, we are through 8 months as of the end of January, which is 67% of the time period. We have spent about 52% of those funds as of the update that Michelle gave us just a few minutes ago through February 12th. We have approved over 3,104 households, so we are definitely serving a lot of folks. Unfortunately, folks, when they come, are having to wait to be seen. Again, you staff for your average, and during the really cold months, things can back up. And right now, we have a vacancy. So that's like 4 folks that are having to try and see all these folks. So they're working really, really hard, doing a lot of overtime and weekend work.
There hasn't been any, how you say, emotional displays with that, you know what I'm saying, getting mad and stuff.
Well, there have been some situations where some of our clients have gotten upset by having to wait for so long to be seen. I mean, 3 hours for some folks, that's a long wait. That's a long wait. And we understand that, but there's only so much four people can do on a given day. And
good service when you act like you're dignified.
Right. And I will tell you that the LEAP staff, Brian's staff, are helping Michelle's staff when they can, if it's not real hard pushing in the low-income energy side of things. So they do help each other out. And I know some of the other economic services staff help key and do other kinds of things to help out. But again, you can't staff for the highest months. You tend to staff for those middle time frames. So.
And it's not by appointment.
No.
So you just walk in.
Right, right.
But there has been some appointments, though, haven't
Well, there have been some times, I guess, when folks can't get in and they have to get a specific ride, and I know we try to work with them where we can, but again, it's pretty much a walk-in kind of situation, because when folks present, they're pretty much at a point that they've got a termination notice. And so they're anxious to get this done as quickly as possible.
I noticed that also that the GUC bill is really going up, because I look at the office when we've been paying much less than this month. It's, even though it was warm, $720-some for GUC, and the lights are off all night, and in the day we don't burn a whole lot on the inside. But I find it quite high when you're not there.
That's right.
And the heat is not being pumped because of the warmth. So a $700 light bill is a bit much.
Yeah.
Even the one at home when it's been cut off for a whole month almost. So I didn't understand that because I wasn't there.
Yeah, and as a reminder, we are not paying anything but the electric part of the GUC bill. We are not paying the water, the sewer, the garbage collection. So folks have got to find that money first before we're able to pay the light bill, and that's part of the policy and it specifically says they have to prove that they have provided that. People text us after they can take a picture of it and text us and say we've done it, and then our folks will then authorize the payment. And folks are usually, by the time you get a cutoff notice, you're 2 months behind, and so they need that whole amount that month so that they can then hopefully start catching up.
So these funds go through how long? When's the?
June 30 will be the cutoff. So
hopefully
actually,
they won't be spent by then.
Michelle. Until they're exhausted, yeah. At the rate we're going, we will have funds through, I guess is what I'm trying to say, through June 30.
So another question, in terms of the numbers and the people you're seeing, how do you wind down the day? Do you stop taking, I would imagine, you have to get out of there sometime. And just in terms of what's it look like winding down in the day?
We continuously throughout the day monitor the sign-in process.
Okay.
And determine early on if we need groups, if we need to have a group session before lunch, if we need to try to do 2 group sessions before lunch, if we need to do a group session after lunch. And on some occasions, we do have to have carryover to the next day. And when we do, as opposed to having them all come in, say, at 8 o'clock, we try to stagger them in groups of 10 to 11 and give them a specified hour to come back the following day. And with those individuals that were carried over to the next day being being our primary focus the following day, right?
That makes sense.
And there are some days when the line is really long. You'll say at 3 o'clock, if you've already got a line that's that long, then maybe we need to put up a sign that says come back tomorrow. I mean, we do it a little nicer than that, but that's pretty much about 3 o'clock. If you can't work it, if it's way backed up, your staff, like you say, the staff have to go home at some point, and so we try to make sure that we see everybody who was in line at 3 o'clock.
But I think that's a fair way to do it. in terms of prioritizing those people that may have not
Right.
been able to be seen that day and give them some priority the next day, so.
Giving them some priority the next day and still trying to begin to see those that have signed in
Yeah.
on that new
You
day.
have a challenge.
Yeah.
Yeah.
But you have some
It
days
is.
that you're seeing 100 to 120 people.
Right, and it's not unusual to have by 10 o'clock in excess of 40 or 50 people already signed in to be seen seeking service. And these are all individuals who have disconnects, either already disconnected or individuals that have threat of disconnect within the next 48 hours, that we're trying to alleviate that crisis for them.
And then that comes out of a separate pot, doesn't it, when they have those disconnects and
It's all coming out of the crisis program.
It is all coming.
Right. Now, you know, GUC has some funds, it's a limited amount, Town of Aden has some funds, so there are funds from other pots that we have access to. And we try to use those when we have them.
And we do indicate, when we call everyone in, when we call individuals in for a group, we do express to them, if they wish not to participate in the group, that they may have a seat back out in the lobby. And we'll see them on an individual basis once we have completed the groups. So, but we utilize the group sessions as an option to attempt to expedite us seeing the individuals and them being able to leave.
And you still got to do the backroom function,
Right.
though, after you let the group go, so.
Right, we do. That doesn't eliminate the remaining process that we have to do with those individuals, but just in an effort of trying to see as many as we can in providing same-day service.
Are you able to track people over time to know if you're seeing the same people every year, or if if these are new people with new crises?
We can, as you key an application into NC Fast, you have the capability to see if it's a reapplication or if it's a new application. And because an individual is only eligible for $600 over one fiscal period, as it comes up, we're able to see how much of that $600 is still available to them. So to say, yes, we can see if individuals are reapplying, but as far as if we're able to extract data to say that this is a report that lets us know reoccurrences, if that capability is in NC Fast, I'm not aware of it. But we can see as we key individuals if it is a reapplication or if it's necessary that we key all of the information.
Other questions for Michelle?
The only other thing I'll add quickly is that we have some staff who have asked to do an event for Black History Month.
Oh,
And so they will be, notices are going to go out, and they will be dressing in traditional garb one day and having a meal together. So we're looking forward to see how that goes.
I better get some black-eyed peas then.
So we're looking forward to see that. They're going to, do some work there. It's the first time we've done that. And tentatively, April 28th, we will be doing a Prevent Child Abuse Day of events at Town Commons. So that's a Sunday, so mark your calendars.
What was that date again?
April 28th. I'll let you know for sure as we get closer that that's the date, but that looks like the date so
Send an
far.
email.
Yeah. So.
okay, thank you, Jan. That was a lot. That's a lot. So looking at your agenda, I think this is the first time that's appeared on the agenda. It's board member reports. And as we've set the agenda, as we've talked, I think all of us are involved in different activities that would kind of come under this category. And so we've kind of formalized this as a, as an agenda item to give people the opportunity to talk about things that they're involved in the community with. It doesn't take the place of board member comments. That's still on the agenda, as you can see. So we just kind of thought that this would be a good place to put this in here and share information in terms of kind of what we're involved with. And I guess that Mary and I were the first on here in terms
So
of...
you can talk.
Oh.
I give you permission.
I will go ahead and set the stage and you can chime in. How's that? And so on the agenda here, we're talking about the regional board meeting that was held here. And I did make some notes, Mary. It was on January the 22nd. And I want to thank Jan and Susan and the staff in terms of helping Coral Witchard put this together. She's the regional lead. And this was the regional meeting for the Social Service Board Association. So periodically they travel and they came down east, and I don't know how many counties were there.
19.
19 counties were represented, and it was really a nice event. And as I listened to Jan talk about Medicaid transformation and talk about the MOU, those were two items on the agenda. And what strikes me was we had Michael Beckett come down, and he's the Assistant Secretary of Human Services, and he talked about kind of the MOU process, and we had another individual talk about Medicaid transformation. And what they talked about on January the 22nd, there was just so much information coming down the pike. I mean, they did not have nearly information.
I didn't think it was enough time to get all the questions in and get everyone's answer, because it was really going. The first time we had plenty of time. This time I thought we did not have enough time for the issues of the counties to address what they needed. It was a very well attended place, but I thought it was too stressful of time usage for people to get their questions answered.
And again, what I think about is just in terms of trying to keep on top of all of this, just in less than a month, how much more information has come down the pike. So I know that that's a challenge for everybody trying to stay on top of this. But I appreciated the work that was put into this, and I think it was very well attended, and I enjoyed it.
I'm going to start listening to more of the conference calls because I feel, but you can't when you're in another meeting. So I did have two that day. But the thing of it is I think it would be more beneficial to listen to those as a member of the Social Service Board, because you do get to hear from other county commissioners, and we're squawking. We are squawking. And then
we heard some of that day.
You did. You did. I try to be mild, but it's not good to hold an agency accountable for something they have no control over. And some of that I felt like was it, because you're data driven and you can't get the data, or you are held accountable when funds. And they don't send them down either like they should. And see, that's my whole kick and poodle. You do what you're supposed to do, and then you can require the staff to do what they're supposed to. And that bothers me, that the agencies have. And this is a human service agency.
Yeah.
I'm not going to preach, y'all.
So one other thing that I'd like to mention is that the end of this month, I think it was on the 31st, Ms. Elliott pulled together a group in response to the government shutdown, and really proactive on her part, and to talk about possible implications. I think the shutdown was settled the day before, but still we carried through with the meeting, and so she set the stage for that, and I'm happy to report the United Way picked it up from there. So those meetings will continue to really look at implications in food, in terms of like food security and all of those things that possibly could be implicated if, in terms of the government shutdown.
Aren't we looking at another shutdown?
Potentially the 15th, but it sounds like they may have reached an agreement, assuming the president signs it.
Yeah, he's saying he's not happy about it.
So those were the two things that I'd like to report on. Anybody else want to share information? Dr. Bunch, we had talked about the child abuse prevention project.
Sure. Jim and I have been going to those meetings along with Ms. Elliott, who has been primarily the facilitator of those meetings. And during the past 3 meetings, we have been looking at doing asset mapping of community resources to kind of figure out what do we have in the community, what agencies and resources look at child abuse prevention, those kinds of things, and to look at the gaps that we have. And in doing so, it kind of helps us realize who needs to come to the table that we can partner with. And so I think at the last meeting, we had 1 additional person, 2 additional people to come to the meeting, someone from the Salvation Army, and I can't call his name, the guy from Trillium was there.
Keith Letchworth.
Keith Letchworth was there. And so all these people have access to data that will help us complete the asset mapping. So I feel we're moving forward and making some progress.
Thank you. Thank you for that. Mary, you have anything else you want to report on? Or?
Oh, absolutely not. It's just that somehow or another we don't know what to put on in the mornings and pull off at night.
Okay.
You know, that too is stressful for the body as well as, you know, health-wise.
Okay, so moving on, I guess we'll move right into board member comments. Do we have any other comments in terms of things? Anybody else would like to say?
I've said all I want to say.
Okay. Well, if not, I guess I will entertain a motion to adjourn.
A motion to adjourn.
And I'll second. Okay, thank you very much.
You don't find me wanting to sit here a long time.